Well, good morning. My name is Ruth Perou, and I'm with the Centers for Disease Control and Prevention. And thank you to Bill and to Hendricks for that sort of introduction of what we're trying to do here and what we're trying to get done. And I want to leave the bulk of the time for the speakers because we're very excited to hear about this. But at the CDC, there's nothing like a little early morning data to get us going. So this is really exciting for us. But, as both Hendricks and Bill have mentioned, we're talking about the future, so we're going to be hearing about some very innovative prototypical work that's been going on how to really utilize data to change systems. And the reason we want to change systems is to improve child outcomes, and that's why we're here. So I'm very excited to have the three speakers, and what I'm going to do is go ahead and introduce them, a little brief introduction and what they're going to be talking about. They'll each be speaking for about 15 minutes, and then we want to leave a lot of time for questions and interaction and discussion to see how we can really learn from them and garner from them the brilliance that they've brought to some of these issues and some of these challenges, and to see how we can scale it up and make it sustainable throughout the nation. So this morning we have Ann Sheridan, and she's the Executive Director of the Maryland Governor's Office for Children. The GOC works to promote health and wellness among youth and seeks to address the priorities of Maryland's children. Previously, she served as a manager of the Maryland No Kid Hungry campaign at Share Our Strength and co-chair the Maryland's partnership to end childhood hunger. Ann has years of community relations and field operations experience, working as corporate director for community relations at Harris Entertainment Incorporated, as well as the Carrie Edwards campaign in 2004 as principal of the Dewey Square Group. And again, we're very excited to hear more what's going on at the state level and how the state of Maryland has really tapped into multiple data sources and looking data to prioritize and move to action. So looking forward to her talk. And then I think we have Fatisha McClare, and I don't know if she's shown up yet or she will be. Lots of traffic out there. So, but I'll go ahead and introduce her, and then depending on when she arrives, we might switch to the order of speakers. But Dr. McClare is a research analyst in the Center for Medicare and Medicaid Innovation at the Centers for Medicare and Medicaid Services. Dr. McClare leads the evaluation of many of CMMI's mental health-related demonstrations at the Research and Rapid Cycle Evaluation Group. I like that, rapid cycle, to bringing forth action. The Division of Research on Vulnerable Populations and Care Transformation. She also co-leads an interagency group organized by CMMI concentrated on the investigation of behavioral health and primary care. Additionally, she provides consultations to CMMI and other CMS components in the development and evaluation of new mental health-related projects. And Dr. McClare is going to looking at a specific data source or data system, and it's really looking at healthcare expenditures for children with disruptive behavior disorder in Medicaid and CHIP. And what we're going to see is just the variability of the quality of the data that there is nationwide, but bringing to light about that data resources and how we can tap into it. And again, and the last speaker is Bob Gerge. Close? Okay. And Bob is a senior research fellow at Chapin Hall at the University of Chicago. Dr. Gerge developed Chapin Hall's integrated database on child and family programs in Illinois, which provides a comprehensive picture of child and family use of publicly provided or financed service system. He is also the principal investigator of the National Survey of Early Care and Education, and is a senior fellow at the Computation Institute, where he is co-PI and an NSF-funded grant. Dr. Gerge is the executive director of the Master's Degree in Computational Analysis and Public Policy and a senior fellow at the Harris School for Public Policy Studies. He is a member of the panel on modernizing crime statistics of the National Academies of Science and a technical work group member of the National Study of Child and Adolescent Wellbeing. He is also the co-founder of the International Society for Child Indicators. So, and Dr. Gerge will be talking about multiple service systems use among Illinois families. And again, what Bill mentioned earlier, that when you look at these families, their health, their well-being is sort of manifested across all these multiple systems. And so how do we bring all those systems together, all those data sources, to better understand and really to better serve and better promote their outcomes? And so very excited, and as you can see, we have an extraordinarily very well-talented panel. Looking forward to their presentations and then for questions. Thank you.